I'm joined by Nadra Ahmed and Ryan Shorthouse. First of all, Nadra Ahmed, good evening to both of you. Tell us about the challenges facing the care sector at the moment.
Well, I think we've got to be very clear that the care sector is probably at a very precarious point in its history. We've seen the pandemic erode any resilience the sector had, and we've now also begun to see that we have a workforce crisis like no other. 165,000 vacancies. We're going to need another 400, nearly 500,000 people by 2035. We're just not seeing people come forward. And of course, now what we also face is the increase in energy costs, which will impact all of us. So all of this put together with a very poor funding settlement that comes to providers, it is putting providers in a very fragile place, and
So let me just interrupt there. Sorry, I want to ask you specifically about that. You talked about the 165 vacancies in the care sector, and I want to ask you about that. Liz Truss wants to increase targeted immigration. How much of a help would that be?
So the 165,000 vacancies are there and growing. International recruitment is a short-term fix to this. And of course, it's very welcome because obviously some of the people that left our sector pre-pandemic was because of the Brexit, the hard Brexit. So it is a short-term, but it can't be a long-term solution. We have to find a solution where domestic workforce see social care and its image as one that they want to buy into and that they can see a career pathway through. And that's what we've got to work on.
Well, Ryan Shorthouse, let's stick with social care. Do you agree that there is no fat to be cut in the social care sector?
Well, I think it's going to be very difficult. The evidence seems to suggest lots more funding is needed for social care generally. I think where there are inefficiencies, more likely to be found in central government departments, their headcount, central government contracts, and also arm's length bodies. There's legitimate questions about whether really the state should be funding those things, and perhaps they should be covered by voluntary or private sector funding instead. But, you know, a lot of what happened during the 2010s was public services like social care really were cut quite substantially. So there's less slack in the system. So, you know, the cuts which the Chancellor is now proposing will be more painful, and people will blame the Conservative Party for that because it is really coming about because of the mini budget.
So it's not just a mini budget. We've already got the NHS in severe difficulty at the moment. You've got, I think it's 7 million waiting for operations in England. You know, is there a different model? Is it time? I mean, this is partly, I think, that you have written a paper on this, the idea that there would be a different kind of funding model. Might there have to be radical surgery to the NHS and indeed a different way of funding, a kind of co-funding for people who can actually afford it?
Well, as we know, in the 2010s, the NHS was protected. So there was real terms increases in the funding for the NHS during that time, unlike any other public service department. As I think Newsnight said earlier in the programme, other countries have different models. And I do think, for example, we need to expand co-payments. We have that for dentistry, for example, which is means tested. So people on the lowest incomes are protected from it. But perhaps we need to be looking at more co-payments for different NHS services to improve the efficiency of it.
Yeah. And that free at the point of need would no longer exist if that happened.
Well, I'm not saying necessarily for all services. And like I say, I think it should be means tested, so people on the lowest incomes would be protected. But I do think it's worth looking at expanding co-payments because it does work in dentistry.
Now, let's move on to a slightly different area, Nadra, and this rumour tonight that there's going to be a delay in introducing the cap on how much people actually have to pay for their own old age care. Is that a reasonable change, do you think, given the situation we're in?
Well, I think the plan has been patchy, to say the least, and we know that the local authorities have been resisting that particular model for a little while, because unless it's properly funded, we're not going to be able to make it deliverable. And there's no point going forward with policies where they are not deliverable. It will have an impact because, of course, the private fund market is where a lot of the providers are now having to look, because local authority funding is so woefully inadequate for them to cover their costs, that it is very, very difficult for us to know how that will all be funded in order for it to go ahead. However, we've got to look at different models now. What we do now just does not work. And what's important for me to emphasize is that if social care works and is robust and is adequately funded, then we will see the release of pressure on the NHS so that they can get on with acute care.
Thank you both very much indeed.